Sleep apnea disrupts millions of lives, but the standard solutions are not the only options. What if you could reduce your sleep apnea events by up to 50% using specific exercises? Beyond reducing apnea events, these exercises have been shown to slash snoring by over 70%. Then there's the established method, weight loss, and its power is absolutely undeniable. In this video, we'll dissect both methods, show how they really work, and reveal their combined power. So, let's start with the data. Exactly how effective is losing weight for sleep apnea? The science is clear. A 10% drop in body weight can cut your apnea-hypopnea index, or AHI, by an average of 26%. For some, losing 5 to 10% of body weight is enough to achieve complete remission, bringing their AHI below 5. But why does this work? Is it just reducing chest pressure? The actual reason is far more targeted and surprising. Studies reveal weight loss specifically reduces fat deposits located inside the tongue itself. A smaller, less fatty tongue is less likely to fall back and obstruct your airway as you sleep. So, reducing tongue size is key. But size is only half the equation. The other is strength, which is where throat exercises come in. These exercises, called myofunctional therapy, are targeted workouts to strengthen the muscles of your tongue, soft palate, and throat. Think of it like building a scaffold. A toned airway is less likely to collapse when you relax during sleep. One key player is the stylopharyngeus muscle, which supports your throat walls. A lack of tone here is strongly linked to apnea severity. Here's a twist. Scientists once blamed the main tongue muscle for relaxing too much. New evidence suggests it's actually overworked and fails from fatigue. This means exercises improve the endurance and coordination of the entire airway support system, preventing that nightly muscular failure. And the results of this targeted training lead to that remarkable 30 to 50% reduction in apnea events we mentioned at the start. The science is impressive, but what do you actually do? Exercises are simple. Press your tongue flat against the roof of your mouth and swallow. Or slide the tip of your tongue back along your palate. Even singing works, as it engages and coordinates many of these key muscles. But consistency is non-negotiable. Benefits require about 15 to 30 minutes of practice daily for at least 3 months. Consider this. CPAP, the gold standard, has adherence rates as low as 38% after 6 months. An active approach can be more sustainable. We have two powerful approaches, but is one always better? The situation is more complex. Let's be clear, weight loss is not a guaranteed cure. If your apnea stems from anatomical factors like a narrow jaw, it may not be enough. Remember we asked how weight loss works? One study found reducing waist size had no independent effect on AHI. This reinforces that it's about targeted fat reduction in the throat and tongue structures, not general body fat. This is where throat exercises have a unique advantage. They can be highly effective for non-obese patients whose apnea is due to poor muscle tone. So one method targets the mass in the airway, the fat. The other targets the muscle of the airway, its structural tone. If they target different root causes, what happens when you combine them? This is the ultimate insight. You use weight loss to reduce the tongue size while using exercises to strengthen the muscles holding that airway open. It's a two-pronged attack on airway obstruction, which is why many now recommend a combined approach for optimal results. You're re-engineering your airway from two different angles, creating a holistic improvement. So what is the final verdict in the battle of weight loss versus throat exercises? It was never a competition. Both are potent, science-backed methods that address different fundamental causes of sleep apnea. Weight loss reduces the physical mass. Throat exercises improve muscular function. The best strategy depends on your specific circumstances. But for many, the most powerful path forward will be a combination of both. A sustainable lifestyle change paired with targeted muscular training. Talk to your doctor. Understand the why behind your apnea and build a personalized plan. Taking active control of your sleep is within your reach.